Thank you very much for the very kind introductory words. A month back, a medical student, a female, a 19-year-old girl, messaged me at 10:30 p.m. And the WhatsApp message read, "Sir, I spent a night yesterday in a hotel with a boy." I typed congratulations, and I thought for a moment whether I should send it, because these days screenshots fly like wildfire. So I just resisted my temptation and I did not send that message. I just kept mum for a couple of minutes because I knew that communicating this message doesn't mean anything, even though I felt happy that as a teacher, as a medical teacher, I have reached that stage where students can reveal anything to me. Then came the next thing. The problem is that, sir, a golden chain, 8 sovereigns, was kept in the hotel room and forgot to take it when we left in a hurry. When I called that hotel, those people told that it is no longer available there. What should we do? So she was asking my expert opinion regarding how to go forward about it. I was really worried and surprised, like how can a person forget such a very precious ornament after sex? I asked her and she told me that we snorted before making out, which means the present generation's sexual behavior includes using aphrodisiac drugs, inhalants or anything before having sex. So that could explain the reason for increase in the prevalence of HIV in certain parts of Kerala also, because this habit of using drugs and having sex is increasing, and you know how damaging it could be in the long run. So coming to sexual health and diabetes, as we all know, 1 out of every 3 persons with diabetes will have some sexual problem. Low libido is a very common phenomenon. And there are certain factors which enhance the chance for sexual dysfunction in diabetes, including old age, comorbid depression, hormonal factors, reduced energy levels, stress, relationship conflicts between partners, and some medication adverse effects. And of course, as we all know, diabetic neuropathy is a reality. It is another factor which contributes to sexual dysfunction. So why are doctors ghosting about it? Or in fact, why are doctors afraid or disturbed or ashamed about asking about the sexual history of a person with diabetes? We should never hesitate, because as WHO has very clearly pointed out, an erectile dysfunction is a prodrome or a trailer for potential coronary artery disease. As Dr. Junaid has very rightly pointed out, this arrest which happens in the penile vasculature is a trailer for potential coronary artery arrest in the future. So it is an important thing we should never hesitate to ask. So the sexual problems in diabetes, as we all know, it can belong to these 5 categories. It can be erection difficulties, premature ejaculation or other kinds of ejaculation problems, decreased arousal, which could be a dopaminergic central phenomenon in fact, decreased stimulation, decreased orgasm, and pain while having sexual intercourse. So what are we supposed to ask, and how are we supposed to ask the history of sexual dysfunction when a person is coming with diabetes? Every time he is coming for review, whenever you ask so many parameters like your appetite, how you have been feeling like, is there any abnormal sensations in different parts of the body which are suggestive of neuropathy, don't hesitate to ask about the sexual function also, because sexual function is another biological function. If you are comfortable to ask about sleep, appetite, about the bowel and bladder habits, the next biological function which we should automatically and spontaneously ask is regarding the sexual function. So we need to ask about all these 5 aspects, because the sexual disorders can be classified into desire disorders, arousal disorders, orgasmic disorders, and pain disorders in broad. So we need to ask about all these. Do you feel like having sex? It's a very simple question which can address the desire part of it. Of course, there could be hundreds of reasons why the person may not have a desire to have sex, ranging from a tiring working day to interpersonal conflicts, to medical issues, to depression, to sleep deprivation, so many things. But of course, it is worthy to ask that question. So do you have a strong erection is a question, which is another question which we can very simply ask. And do you feel that the strength of your erection has been coming down of late? It's another way of rephrasing that question also. The problem here is toxic masculinity equates erection with masculinity. So we need to emphasize and impress upon them that there's nothing to do with masculinity. It's a medical matter. So erectile dysfunction is a medical problem like all other medical problems which we are supposed to treat. And who should ask about this and treat it other than medical practitioners? Of course, what is your length of sexual activity like? It's a very difficult question to ask, but don't hesitate again, because premature ejaculation can happen due to various reasons, and diabetes is one of the important reasons. So by definition, premature ejaculation means having an ejaculation within 1 minute of having an erection strong enough for a penetration. About whether you are getting satisfaction about your sexual life, there are several questionnaires also which I'll discuss subsequently. But a simple way of asking that question also. Do you have pain while having sex is another thing. Dr. Trivandrum has already elaborated about female sexual dysfunction, but dyspareunia and vaginismus is a very important part of female sexual dysfunction in diabetes. So the risk factors for erectile dysfunction in diabetes, all these we should be mindful. And in those patients who have these risk factors, proactively ask about sexual function without hesitation. Those who are obese, hypertensive, smoking, who have lack of exercise, or who have got a comorbidity of depressive disorder, anxiety disorder, or who are introvert and have a low self-esteem. It's very important because almost all these factors can be the preventive risk factors for dementia also. The Lancet Commission Report 2024 about preventive measures in dementia has identified 14 specific risk factors, which properly controlled can lead to 45% reduction in the prevalence of dementia. So this includes low education in early age, increased LDL level, traumatic brain injury, depression, obesity, hypertension, diabetes, reduced physical activity, alcohol more than 21 units per week, etc. in the middle age, social isolation, environmental pollution, and visual impairment in old age. So you can see at least half of them are given in this list also. So these risk factors, if it is identified, addressed properly, will not only improve the sexual function, but can also prevent the person from developing dementia in future. So the legendary study, which clearly shows that 52% of those with diabetes had erectile dysfunction, 17% had minimal, 25% had moderate, and 10% have total ED. So we should be able to pick it up at least at the minimal stage and properly address it, because a healthy sexual function is an important factor which motivates a human being to go ahead and have a life. So it is our responsibility as physicians to identify and treat it. Of course, in diabetes we have got ejaculation disorders also. Apart from the conventional premature ejaculation, there can be retrograde ejaculation and anejaculation also, which could be commonly seen in diabetes. What about women? Dr. Trivandrum has very clearly elaborated, but still a mention about them. Vaginal dryness, vaginismus, that is sudden contraction of the vaginal muscles preventing a normal smooth sexual intercourse, dyspareunia, reduced libido, vaginal infection and inflammation, and frequent urinary tract infections are also very common in people, females with diabetes. So what to ask? Again, these things we should very clearly ask about the strength of erection, the frequency of erection, especially early morning erections. How is your ejaculation like? Is it premature? Is it delayed? Do you get orgasm as frequently and as common and as strong as you did in the past? Do you have any kind of pain during the act of sex or during the climax? Are you taking any medications? Because the medication adverse effects is very important in addressing the sexual issues. Whole lot of medications, right from beta blockers, can have sexual adverse effects. Some antidepressants also can have sexual adverse effects, because depression is very common in diabetes. Around 45 to 50% of those people with diabetes can have comorbid depression. And as a rule, commonly selective serotonin reuptake inhibitors are prescribed for the treatment of depression. In diabetes also, they have their own advantages, especially drugs like sertraline, because of the action on the beta-2 thromboglobulin, can have a mild antithrombotic efficacy which can prevent probable coronary events in future. So it works that way. But the problem with serotonin reuptake inhibitors is, because of their action on the 5-HT1A receptors at the spinal cord, they can produce delayed ejaculation very commonly, and erectile dysfunction in up to 10 to 15% of cases. So if we find that such an adverse effect is there, it is prudent to shift to another antidepressant which doesn't have sexual adverse effects, like say vortioxetine or bupropion or mirtazapine, because such options are also available. And of course, substance use. I started my talk by discussing about how the sexual behavior of the youth is changing, because aphrodisiac drugs are very commonly used by the younger generation. Even people with diabetes do use it, because they use it as a self-medication to get sexual arousal. The problem is that a sudden increase in the level of dopamine, we call the tonic increase of dopamine, which is produced by the substances, on chronic use can lead to a dopamine deprivation or deficiency syndrome, as a result of which you don't feel any sort of pleasure at all, a sort of amotivational syndrome, very commonly seen especially in people with diabetes, youngsters who indulge in substances of abuse. So again, as we have already mentioned, asking about ED is very important, because it is a primer for an underlying coronary artery disease. It could signify an occult cardiac arrest, and it could, as Dr. Junaid has very rightly pointed out, indicate hypogonadism. So just a mention about the scales which are commonly used, if in case you are not very comfortable in asking directly, these scales may help. International Index of Erectile Function, Abbreviated Sexual Experience Scale, Erectile Dysfunction Assessment Scale, Female Sexual Function Index, and Change in Sexual Functioning Questionnaire. Some of them, a lot of others are also there. Out of these, the IIEF is very commonly used for assessment of sexual problems in diabetes. So along with pharmacotherapy, certain things called sex therapy, which we need to understand as clinicians, because diabetologists may not have a long time to discuss and teach about sensate focus technique, start and stop technique, and all those techniques, They may not have the time for dual sex therapy, which is the conventional method which is used. But of course, eclectic sex therapy techniques, about positioning, about the timing, simple advices like don't have a heavy dinner before you indulge in sex, the timing of medications with sexual act, all these things, and also understanding the erogenous zones and mutually stimulating the erogenous zones. This could be very subtle things which you can include in your therapeutic sessions without wasting much time. So thank you very much for your patient listening. I think I have finished ahead of time.
Thank you, sir. So I think you have touched upon so many things with regard to ED and particularly in diabetes. But like what I said with regard to female sexual dysfunction while Ravindran sir was discussing, many a times when we are seeing our patients at OPD, we don't get enough time to take a proper history with regard to when you started. In the beginning itself, you had quoted so many points while asking in detail with regard to erectile dysfunction. So how do you see among your patients with diabetes, are these things being addressed in the way it should be?
Male sexual dysfunction is addressed to a certain extent. Female sexual dysfunction in diabetes is largely a neglected area, at least in our part of the world. And that is one important thing, especially in people who are, young and have got diabetes. So many issues which they feel hesitant to discuss to the therapist. And they are also afraid of being slut-shamed or being looked down upon in case they discuss about their sexuality or sexual rights, I would use that term. But I think we should become more proactive because, as it was very prominently discussed in the previous session also, having a positive and healthy sexual life improves immunity. It is one of the very important factors which defies senescence and also acts against the concept of ageism. So we need to proactively ask. And if you don't feel comfortable enough, have a diabetes educator belonging to the female gender who may be, patient also may be better comfortable, but at least over a period of time, we should reach a stage where we are comfortable in discussing about this in a very non-judgmental way with the patient.
Thank you, sir. Any questions from the audience?
Doctor, this aphrodisiacs blood the memory to forget a necklace.
You know, the substance which this particular girl consumed was crystal meth. They think it is MDMA, but crystal meth is somewhat similar, but much less cheaper, much more contaminated, much more dangerous. It creates a high which is short-lasting to such an extent that feel that the entire world is your territory, your paradise. That happens. And by the time this act was over, they spent hardly 1.5 hours in OYO room. And by the time they reached home, then only they realized that this was absent. That happens. It's not a very rare occurrence.
So I think with that, we will conclude the session.
Drugs which are more favorable for diabetes like pioglitazone, SGLT2 inhibitors, GLP-1 agonists, etc., which have better effect on the endocrine.
Yes. Yes, definitely those drugs. Absolutely, they should be promoted, but each drug can have its own effects. For example, the SGLT2, they can increase the chance of urinary tract infection. It could be a problem in some females. So we need to individually tailor the drugs and decide what is, yes.
Thank you, sir. Thank you.